lucky patients of this practice at least have the possibility of seeing a dentist, which is not going to be an option for everybody. But there's still work to do to get this surgery ready, so they've been trying to put their measures in place this morning before seeing some patients this afternoon. You can see the temperature scanner there that will be used for every patient that comes in. The waiting room actually will stay empty because the reality is that patients will be brought in one at a time. You'll be told to wait outside. You won't even be allowed to go to the toilet, and the dentist will have to use loads of extra protective equipment to keep people safe. That's been the hurdle that's kept some practices closed today. Well, let's have a quick chat with Emma, who's one of the hygienists here. How's it been for the last few weeks, Emma, not been able to see patients?
It's been really difficult. We've got a lot of patients emailing, calling us, asking for their routine hygiene appointments. But due to the amount of aerosol that we produce while we're doing their scan and polishes, it's just something we can't physically do at the moment. We're having to wait an hour in between 30-minute appointments where we're usually back to back. So we're finding that the amount of patients we can see has been cut down to about a third, and that in combination with the cost of the PPE means that a hygiene appointment's not financially viable at the moment, and it's been a real difficult kind of hurdle to get over.
So it's just emergencies at the moment. You're not going to be seeing anybody for that kind of routine care?
No, not for the routine care. We will try and help patients in pain and discomfort, but because we can't produce those aerosols, it means that a lot of what we would usually do to help a patient, we physically can't.
And you think what you do may not even be possible under this new model? You just won't be able to make money?
Well, with current guidelines that we've been given, it's just proven really difficult because the kind of scaling, the polishing, the ultrasonic scaler that we usually use to kind of get as much build up off as possible is something that we're being really limited on use at the moment, and they're saying, you know, you need to just hand scale, and that is actually really, really difficult to see a larger volume of patients just hand scaling. It puts a toll on the hygienists as well.
Okay, thanks a lot for now, Emma. They would normally see about 160 patients in a day here because there are 8 dentists, but to give you an idea of why they're only going to be able to see about 10, if we look into this treatment room, which is now a PPE preparation station, this is Paula, one of the dentists here. Good morning.
Hi, good morning.
Just talk us through the sorts of equipment that you're going to have to wear.
So there's a lot of kit to wear. So we've got our gowns, we've got our hair nets, we've got the masks, we've got the aprons. So it's quite intense and there's a lot to wear, and it can get quite uncomfortable and hot. Now with a cool day today, it's not too bad, but with the summer coming up, it's going to get even more uncomfortable. We can't use the air conditioning unit, so it's going to get even more hot for us.
And this is all about stopping the spread of the virus,
exactly,
keeping you and the patient safe.
Yeah, so this PPE is to keep us safe, to keep our patients safe, but also trying to treat them as much as we can in this quite difficult time.
So what do you think it's going to be like? The waiting lists are not going to go down anytime soon?
They're not going to go down, they're probably going up at the moment, so it's getting busier and busier, and already the phones have started calling so much, but we're going to do our best and see what we can do with the patients.
Okay, thank you very much for your time this morning and for letting us be here, get a bit of insight into what the reality of dentistry will actually be. But this is one of about a third of practices across England that is actually even able to open. 2/3 saying they just don't have the right numbers of protective equipment. And some of the costs of that equipment, dentists are saying it's gone up 6,000% for some items. Well, we've had a statement from the Department of Health that says we're working round the clock to make sure frontline healthcare staff have the protective equipment they need, and we've made further supplies available to the dental sector via wholesalers last week. Well, it hasn't come in time for every practice to reopen today, and the warning is, even if your dentist is starting to see patients, it's only going to be possible this week at least for the most urgent cases.